Today, you will learn how the diverse range of arthritis conditions can affect your business health. You will hear from Dr. Paulo Pinho about how arthritis can impact your workplace, as well as from our panelists, Keith Winnick and Diane Hettinger, on employee wellness. You will finally hear from Arthritis Foundation about Arthritis Foundation's resources from Stephanie Hudgens. Our first presenter is Dr. Paulo Pinho. Paulo Pinho is a physician splitting time between a clinical practice and a consultancy in clinical informatics, addressing strategic health data acquisition, interoperability standards, machine learning, and predictive modeling to follow and evaluate at-risk patients, lending insights to various healthcare stakeholders. He was born, raised, and still lives in Union, New Jersey. He earned his bachelor's in engineering science from NJIT and his medical degree from New Jersey Medical School. He is now a Rutgers SHP Biomedical Informatics Master's Candidate targeting completion in fall of 2025. He has practiced medicine for 25 years and is board certified in internal medicine, pediatrics, clinical informatics, and insurance medicine. He founded and ran Pace Healthcare, a medical practice serving over 8,000 patients for 10 years. Since then, his clinical experiences have ranged from poor village clinics in Haiti to concierge practices in Singapore. He has a passion for informatics that came from prior roles as Chief Medical and Strategy Officer of Discern Health and Medical Director of Innovation for Diameter Health, where he has provided clinical expertise and thought leadership on regulations, quality measures, and healthcare data standards and technologies relevant to clinical data and solutions. For fun, he enjoys spending time with family, traveling. He is on the local board and the national board of the Arthritis Foundation and in organizing, providing village-based medical in Haiti. He enjoys running and has completed a half marathon in all 50 states. Please welcome Paulo Pinho.
Thanks, Emily. Appreciate it. And so it's great to be here. This was actually something that we used to do in the New Jersey market. When I first started with the Arthritis Foundation, we started actually going out into individual programs, had a regular address to the business community. I think COVID kind of changed things around and changed the format a bit, but I think it's still an important, topic to discuss because I think, as population is changing, as there's an increasing supply-demand mismatch of healthcare needs as well as healthcare in comparison to healthcare providers. Having this kind of insight is really important to employers because this is how I think we start to tackle some of the challenges that are going to happen from a healthcare standpoint as our population evolves. And so I'm going to, there's a lot of information on these slides, a lot of sort of data. There's a test at the end, so do memorize all the numbers. No, just kidding. But just, want to spend some time just kind of addressing the problem and how big it is, and, potentially get to the point where we're addressing solutions as well. So in terms of, arthritis is really a bunch of different things, but all in all, about 1 in 4 Americans has doctor-diagnosed arthritis. And so the key thing is that it's not really a one size fits all. And you can see the number of people that have, arthritis related diseases like osteoporosis or things like osteoarthritis or some of the more autoimmune types of arthritis. If you count those people that don't necessarily have, provider diagnosed arthritis, the numbers actually double. And these are people, the remaining sort of other half are people that suffer in silence. Many times they have pain associated with their disease, but sometimes it could be silent and we really don't see anything until repetitive wear and tear kind of makes a dent and starts to cause pain and limitation. Of note, arthritis can really happen at any age, and that's really important. And you can see the statistic that even children with arthritis, and this can affect their growth and development and sort of their adult, mobility. There's more children that are diagnosed with arthritis as compared to cystic fibrosis, juvenile diabetes, and leukemia combined. So it really is a significant toll. And so just want to kind of hammer that information home. In terms of, arthritis, the osteoarthritis version of it, which is the arthritis that we sort of append to the aging process, It is the second most common chronic condition in the United States, and it's the second most common reason to visit a doctor. As age increases, so does the likelihood of arthritis. Being female is actually a risk factor for arthritic conditions, not only osteoarthritis, but also some of the inflammatory arthritis as well. And there's other demographic trends, such as the aging population that I mentioned previously, as well as an increase in obesity and inflammatory diseases that are really increasing the likelihood of osteoarthritis. So it's, these are things to kind of keep in mind as we start to see, not only population aging, but disease becoming more complex, disease becoming more diverse, et cetera. Arthritis does impact at-risk populations, so it disproportionately affects Blacks, Latinx population, as well as American Indians. And so not only is their presentation greater, but sometimes there's social, cultural, and medical biases that present reasons as to why they don't get diagnosed appropriately, and often may not, get treatment appropriate. We know that pain is very subjective, but also the treatment and interpretation of pain by clinicians is very different in different populations. So keep that in mind in terms of the populations that are actually being impacted. It's not, just about the disease when it comes to arthritis. So we think about joint inflammation as being what arthritis is, but really arthritis can come associated with a whole host of other things like fatigue due to inactivity and sleep disturbances. And oftentimes 50% of patients will actually report this. We talked about obesity being a risk factor, but it can also be a consequence of the disease where patients develop, because of sedentary, behavior, start to have weight gain, which sort of, becomes a vicious cycle when it comes to arthritis, progressing. 50% risk of coronary artery disease in patients with arthritis. So that's, a big cause of all-cause mortality. And 1/3 of patients have 5 or more chronic conditions in addition to the arthritis. It actually increases overall mortality by about 55% when a person has a form of arthritis. And I think the bigger issue is that there's a significant mental health toll. 58% of patients feel that their disease is misunderstood. They oftentimes have things like cognitive dysfunction. 2/3 are actually reporting anxiety in the preceding week, and this is a twofold increase as compared to someone, who doesn't have arthritis, and that's super important in terms of how we manage these patients. 71% will report depression at some point throughout their illness, and their functional limitations increase their stress risk, decrease their life satisfaction, and that's important as well. And this is just sort of some of the impacts on activities of daily living. Sort of requiring, needing help for routine needs, needing help for personalized care, for walking assistance, needing help to address things like work limitations, being unable to work because of health issues, or being limited in their ability to work. So this is, kind of an important thing when it comes to how a person perceives themselves, within the context of their disease, but also within the context of their community. And just briefly, globally, some more statistics that I'm not going to read, but suffice it to say that about 528 million people are diagnosed with arthritis, and 344 million of these actually report moderate to severe arthritis enough to cause disability. Patterns really follow those of the United States. The knee is the most common joint involved, followed by the hip, and then followed by the joints of the hands. And what I think I want to hammer home here is that arthritis is not a rite of passage. Like, we think about it as a disease that we're all supposed to get as we get older. And oftentimes it doesn't sort of create that sort of, desire and impetus to change. We should be fighting a war against arthritis and inflammatory diseases as well, like we're fighting against other inflammatory conditions and other infectious conditions, and, even other oncologic conditions. So this is something that really does have its toll. In terms of rheumatoid arthritis, this is sort of, the inflammatory, the most common inflammatory arthritis. In 2020, about 17.6 million people had RA. This is an increase over time, and the prevalence is actually increasing for a host of reasons. We know that there's increasing amounts of inflammatory food, population changes, different identification of diseases. So we're better able to identify diseases that oftentimes were occult. And if we think back to the COVID pandemic, we saw the impacts of inflammation, and the treatment of many of the COVID signs and symptoms were actually the treatments that we would give patients with rheumatoid arthritis. We've often thought that there was a viral vector for many of the autoimmune diseases. It's suffice it to say that COVID sort of got us thinking about the fact that maybe this is the type of thing that kicks off the immune cascade that's responsible for diseases like rheumatoid arthritis. And so I'm not going to take you all through medical school, but just to kind of give you, a basic understanding of the different types of arthritis. Osteoarthritis is, again, the gradual loss of cartilage from joints. Most common joints we kind of mentioned previously. You can see sort of the osteoarthritis is really around weight-bearing joints. You start to lose cartilage. You get bone-on-bone rubbing, and it's a degenerative disease. It often happens in joints that have the greatest amount of wear and tear. So, obviously, if it's just about weight-bearing joints in some cases, that makes sense. But if someone, for example, is an athlete and, has an atypical joint that they use in their athletic competition, that actually can suffer from arthritis as well. It also affects the small joints of the hands, so manual dexterity becomes an issue as well. Whereas rheumatoid arthritis and the inflammatory arthritis, often is, swollen, synovial, the joint space. It's an autoimmune disease and, really leads to erosion of bone. Patients with arthritis have, pain, stiffness, swelling. They can have cracking or grating, bony outgrowths. They can have loss of motion and deformity, and they can have gelling periods with inactivity. And the treatment for osteoarthritis is rest, but obviously not complete avoidance of activity. Weight loss is really important, and losing 1 pound of body weight can lead to actually 4 pounds of pressure off of each of the knees, which is super important. Physical activity and nutrition are, very important in terms of getting people back to functional state. Physical therapy and exercise programs are important, using orthosis, heat and cold therapies. It's really important to not only educate patients about, how to exercise, what to do from a weight-bearing standpoint, but also to provide them with emotional, social, psychological support. Managing the symptoms is important to, reduce pain, prevent or delay disability, and improve overall quality of life. And there's medications that we use, things like, Tylenol or acetaminophen, medications like nonsteroidal anti-inflammatory medications, different types of joint injections, either with viscous supplementations, essentially giving back knee lubrication or lubrication into a joint, injections with steroids to reduce inflammation, things like surgery with fusion and joint replacement, and obviously with the increasing opioid, epidemic, avoiding, opioid medications is really super important. Rheumatoid arthritis, and I'll use this as sort of the prototype for all inflammatory arthritis. It is the second most common subtype of arthritis. It affects about 1% of people worldwide. A lot of new cases diagnosed, each year, but it is a big contributor to global deaths as well. They are 50% more likely to die. They have cardiovascular disease as a major cause of death. Males with rheumatoid arthritis die a median of 4 years younger than general males, and females die a median of 10 years younger than general females. So substantial disease in that regard. And again, the female to male predisposition is actually higher among females, about 3 to 5 times that of males. It most commonly affects women in their 40s and 50s, men usually later. It can affect children, or a type of, sort of a childhood presentation of rheumatoid arthritis can affect children. And it has what's called extra-articular involvement. It can affect, not only the joints, but it can affect internal organs, the eyes, obviously the cardiovascular inflammation we discussed. And so some of the risk factors associated with it include gender, heredity, specific genes are associated with it, infections and stress, as we mentioned previously. Typically affects the small joints. It causes joint pain, stiffness, redness, warmth, and swelling. You can have rheumatoid nodules, or these painful nodules that happen in the skin. And they can have other inflammatory conditions like problems like anemia or low platelet count, or, high cholesterol. They can also have cardiac disease and lung disease. And so the treatment is really around, education and counseling, rest, exercise, nutrition and dietary therapy, and then again, medications like nonsteroidal steroids. And there's a class of RA treatment or inflammatory arthritis treatment called DMARDs. And this is really important. It's disease-modifying anti-rheumatic medications. This will play very importantly, as we discuss later on, in terms of the cost the cost burden of the arthritic conditions. DMARDs are super important. They can substantially reduce inflammation. They can reduce or prevent joint damage. They can, preserve joint structure and function. They act slowly, but they can actually allow patients to reduce doses of other medications like steroids and pain medications, often because of the inflammations. They're really designed to prevent and reduce inflammation that ultimately damages joints. And some of the biologics are injected. Some of them are infused. Many times they have to be, prescribed by a rheumatologist. One of the biggest challenges is that rheumatologists are sort of dwindling in numbers, and getting people into rheumatology fellowships has become a challenge. That's one of the mandates of the Arthritis Foundation, to get, sort of the right sort of supply of clinicians to address these demands. One of the other things that the Arthritis Foundation does around an advocacy standpoint is that because of the fact that these medications are expensive, oftentimes there's legislation and regulations that sort of prevent the right people from getting the right medications, things like step therapy and challenges with copay. The Arthritis Foundation spends a lot of time advocating. We know that patients that are put on the right medication, even if it's an expensive medication, right from the get-go, actually do better and end up, having lower cost of care than people that are sort of, put on the wrong medication. It delays treatment, it delays outcome improvement, and ultimately can lead to things like non-compliance that really just, impacts, the way these patients function and ultimately their overall cost of care on a go-forward basis. And so, it's really important to address access issues, again, based on the specialist discussion. And, we really could use, especially with the growing supply-demand mismatch, the importance of technology and analytics to identify those people and personalize the care for those patients that actually need certain medications, and do so in a way that's risk factor appropriate. So it's sort of in the home stretch, addressing the financial toll. Again, a lot of statistics here, a lot of joint replacements. We know that the cost of surgery is high. It's the second most expensive condition that's billed in U.S. hospitals, and the highest costly condition as it pertains to Medicare and private insurance. We know that the cost burden of osteoarthritis is about 3 times that of someone who doesn't have osteoarthritis. For rheumatoid arthritis, it's about 4 times that. A patient with arthritis is more likely to be defined by their employer and their health insurer as a high-cost claimant. Again, medications tend to be a big cost just because of how expensive these, designer drugs are. And so getting them the correct medication from the start is super important, and ends up being cheaper in the long run. And interestingly enough, we talked about some of the medical comorbidities that patients with osteo and rheumatoid arthritis have. Treating these comorbidities like cardiovascular disease, like high cholesterol, like diabetes, et cetera, tends to be higher than treating a non-arthritic patient's version of those diseases. So again, getting people targeted with the right medication not only decreases the likelihood and the severity of their arthritis, but also can improve the cost of treating some of their comorbid conditions as well. Talking about the impact of arthritis at work, it is a top cause of disability in the United States. It's the second largest driver of healthcare costs. In the employed population, about a quarter of patients have some form of arthritis. 90% of patients do say that there's an impact on day-to-day life. There's about 170 million lost days of work, about 300 billion cost annually. And again, life satisfactions not only alter life functional limitations not only alter life satisfaction, but it also alters job satisfaction. So having engaged employees at work sometimes is about creating an inclusive environment that sort of addresses some of their conditions. Getting things like supervisor support, is very important. Total cost, some of the numbers here, 136 billion annually. We see the cost of absenteeism, 2+ days per year as compared to someone without OA of absenteeism. Presenteeism is more difficult to sort of assess, but we can see the productivity hours lost. Direct costs are about 65 billion. The average cost per person, is about 11,000 per person per year. Indirect costs, things like lost wages, total lost wages, you can see what they are for a person with osteoarthritis. But these lost wages often lead people to have more increased sort of financial insecurity, which sort of, creates part of that vicious cycle of people, worsening from a disease standpoint as well. And it's not only an issue in the United States. There's a study that was done in the UK. Some of the reasons for sort of disengagement at work are not only the disease and the pain associated with it, but sort of how the perception of the patient within their work environment sort of exists. And you could see 20% of arthritis foundations were concerned about their fitness for work. 39% were really not confident that they could discuss their disease with their employer. 33% that felt that work colleagues wouldn't understand. About 17% lie about why they're taking sick leave, largely because of some of the stigma associated with, these diseases. And it speaks volumes in terms of having workplace solutions, inclusive environments, retirement options, and disability, programs. Just in terms of some work issues arising from this, 13% of patients with osteoarthritis and 26% of patients with rheumatoid arthritis retire early, as compared to 3.4% of those without. There is the repetitive use aspect of many works. Even some of the, some of the sedentary jobs, have some repetitive use that can worsen arthritis. It does affect disability, and so disability, 7.5% at 1, 18% at 5, and 27.5 at 10 years post-diagnosis. Short-term disability, there was about 54% of patients reported it in the last 6 months. And 66%, median reported in the last year. And the mean duration of that short-term disability was about 39 days, with, really a range of anywhere between 7 and 84 days. And there's other issues that sort of impact work, diminished self-esteem, life satisfaction, problems with adaptation, perceived health status, and higher levels of depression and pain are all sort of worsening factors as well. And at home, they have reduced social participation, they've reduced household involvement, and the work disability does have an impact on sort of their overall cost and sort of economic stability. And you can see some of the statistics associated with that. One special group that I kind of want to focus on is the military. Anywhere between 1 in 4 to 1 in 3 military individuals actually has some form of arthritis. Both osteoarthritis and some of the inflammatory arthritides are seen. It's a top cause of disability amongst veterans, and it's the second most common reason for discharge. Some of their service is sort of pounding pavement, and sort of that causes a lot of sort of joint destruction that can happen. And they're statistically higher to have not only disease, but disease at younger ages as compared to non-veterans. It is the most common service related condition for unfitness. 95% is again related to combat injury. 68% of limited duty claims, they have higher tendency towards things like, ACL injuries, which can obviously worsen, joint damage. A 40-year-old was 2 times more likely to have arthritis in civilian life earlier by as much as 10 years. And again, combat injuries, repetitive use, shock waves, etc. But then, some of their exposures will increase their risk of rheumatoid arthritis and rheumatoid arthritis mortality as well. It does impact their frequency of chronic disease, and the management of these chronic diseases, things like diabetes, hypertension, high cholesterol, and heart disease, all have worse outcomes in patients that are in the military. And so just to kind of close with some strategies before I introduce, people that are, experts, and colleagues of mine that are experts in these fields. Vocational rehab is, important, and it, can obviously improve the ability to return to work. Self-improvement, models have shown, success rate. The earlier that you engage, and in a non-punitive fashion, provides the best benefit. And only about a quarter of people that could benefit from things like vocational rehabilitation are actually in vocational rehabilitation. Prevention is important. 20 to 40% of patients with RA quit their jobs in the first 3 years. And so establishing, not only accommodations, but also ergonomic programs are important. Accommodations, as I stated previously, just, addressing absentee programs, addressing health promotion strategies, things like fitness training, health promotion coaches, and leisure is important. Providing veteran support, for at need and other at need populations. And again, thoughtful supervisor training engagement is really super important as well, because they're a big part of how people perceive themselves. Having sort of occupational satisfaction or job satisfaction is important, and it sort of lends to not only the patient having better outcomes, but also having a healthier work culture for the company. Thoughtful benefits design is important, addressing things like step therapy and copay assistance, making sure that patients are put on the right drugs to start out with and then go back to the preferred drugs when stable. And then addressing things like pharmacy benefits management. Currently there's very little transparency, and sort of some of these sort of third parties really challenge the way patients are charged in terms of their care. And so there's ways to kind of address this, that really should be thoughtful, and we'll lean on some of the discussions that are going to happen forward about how to do that. But then things like biosimilars, group pooling of resources, there's a lot of opportunities that exist when it comes to thoughtful benefit design. And so with that, I'll close. I see there's a question in the chat, but maybe we'll save that question until we, sort of get to the end. Right, without further ado, I'd like to introduce two colleagues of mine. I had the opportunity to work with both of them at Prudential, when I was at Prudential, which is actually the organization that kind of got me involved with the Arthritis Foundation about 8 years ago. And so it's been a really great ride. And these were two people that made an indelible mark on my career because of their subject matter expertise and their care and their attention to detail. And so I'd like to introduce them, and probably understate how important they are to my career, but also to health and well-being of patients. So Diane is a diversified professional with a lot of leadership experience in the ADA accommodation strategy space. She's really focused on accessibility, assistive technology, culture, diversity, and equity, human resources, and employee health benefits design. She's currently the CEO of Enabling Ability. It's dedicated to disability inclusion, equity, and successful productivity of patients with disability in the workplace. She spent 15 years at Prudential, where she was Director of Accessibility and Disability Inclusion, ADA Accommodations and Environmental Health, Clinical Wellness Programs, and Human Resources Business Partner. She's recognized for her expertise in establishing process for onboarding and advancement of employees with disabilities, including accessibility and assistive technology initiatives. She served as the co-lead for the ADAPT Business Resource Group. Prior to Prudential, she had a long career at AT&T in a myriad of leadership roles across the business. In addition to her role as founding steering committee member for Disability in New Jersey affiliate, she is presented externally on disability employment best practices with the National Organization for Disability, Disability in, the Disability Management Employer Coalition, and the National Association of ADA Coordinators. She received her Bachelor's of Science from Hartwick College, where she majored in nursing. She has a Master's of Public Health from Rutgers University and completed an executive management program at the University of Pittsburgh. She's certified as an occupational health nurse specialist, certified employee benefit specialist, and achieved professional association status of the National Association of ADA Coordinators, and is a certified legal nurse consultant. She serves as the president of the Masterwork Chorus Board of Directors. Welcome, Diane, and good to see you. And then Keith Winnick is a seasoned health and wellness professional with over 25 years of experience. He's committed to fostering a culture of health within organizations, focusing on reducing health risks and enhancing performance and productivity. He designs and implements wellness programs, leveraging data to measure their impact and align them with organizational goals. His holistic approach and dedication have established him as a visionary leader in the field. He spent about 20 years at Prudential Financial, where he was Director of Health and Wellness and Analytics. Under Keith's guidance, Prudential's award-winning health and wellness program earned many prestigious accolades, including the C. Everett Koop National Health Award, and the American Heart Association's Fit Friendly Platinum Award, and the National Business Group on Health's Best Employers of Healthy Lifestyles Platinum Award. He has a Bachelor of Science from William Patterson and a master's degree in physical education from Montclair State. And from my intro, you heard that I'm a half marathon runner, ran one in every state. So I have two athletes on the call here. Keith has run a full marathon in every state. Way to show me up, Keith. And Diane is a, climber extraordinaire. One of the stories that I remember from Diane is after I'd be on my way out to the car, I'd see Diane wearing sort of an oxygen deprivation mask and climbing stairs to prepare for a climb at Everest or wherever sort of her climbing challenges took her. So great to have both Keith and Diane here, and looking forward to digging in and asking some questions and learning a little bit more. We'll start with Keith. As you think about employer or corporate health and wellness strategy, what are some of the key components that you see as we think about not only those people that need to remain in good health, but some of those people that have sort of some chronic illnesses like the arthritic conditions, in terms of what are the key components that you need in a strategy to really promote ideal corporate health and wellness?
Yeah, thank you, Paul, and thank you for that nice intro. Wasn't my intention to ever show you up. But before I start, I just want to say thank you for doing this program. As somebody that does suffer from psoriatic arthritis and even was able to run marathons through that, it's a very important issue for me. And I feel in the workplace, especially when you look at the statistics that Paul showed earlier, how prevalent it is, that it is often an overlooked condition that's focused on in the workplace. And so I think that's something I want to just put out there. So when you're designing a health and wellness strategy, I think the first thing you need to look at is what is your company's mission around health and wellness, and really clearly defining what that mission is. Like for example, when we were at Prudential, our mission was to be the most trusted source of health expertise. But we also tied our mission to the workplace. So I think it's important when you're developing a mission that you tie it to the workplace. While we do care, we want to help individuals, be as healthy as they can. I think in a corporate environment, it is important, to make the connection between health, performance, and productivity, really to get that senior leadership buy-in. I always used to say that half my job throughout my career has been justifying my job and really making that case why health and wellness is important. And I don't think that's really changed at all. So I think it's important to have that commitment and that strategy, and really live into that strategy when you're designing your program. Another component of a strategy is having a holistic approach to health and wellness. I mean, over the years, you've seen many organizations develop their wheels of health and different graphics of what they focus on. At my time at Prudential, we developed what we called our 5 dimensions of health, which covered physical, emotional, social aspects of health, spiritual aspects, and we also included financial wellness in there. And I think it's important to focus on all these different areas and design your programs to fit into these areas, because especially when you're looking at conditions like arthritis, I think all those areas of focus are impact somebody's care around arthritis, physical health, making sure they're getting exercise, eating a proper diet, getting the preventive care that they need. Their emotional well-being could be strongly impact their health, dealing with a chronic condition and all that's involved with that, as well as the social and spiritual, having a purpose. And when we talk about spiritual health, I think it's having a purpose in your organization, in your life, and where you want to go. So that's different for everybody. And of course, the financial ramifications of the burdens of especially having a chronic condition. So really, when you're designing, make sure all your programs really impact some of these areas and live into that strategy. I think leadership support in developing a strategy is vital. having that support, especially from a financial perspective, how much money are they willing to invest in that program? I've worked with different organizations over the years. While Prudential, we had a very large, pool of resources to implement programs, being a large company, but I've also worked at small companies. I worked at a union in New York City for a few years, and they had very little resources. So you have to, again, work with what you have, but understanding, that what you can do. I think understanding your population is important, and maybe we'll talk more about measurement as we move on. But I think understanding your population and driving your programs to fit those needs of your population, and there's a lot of different ways to identify what the needs are of your population. Make sure you fit that in there. And I think incentives are a great component of a wellness strategy too. If you can do those, they do help with engagement and getting people engaged. But that's not the end all be all in designing a program. So I think the big message is really developing your strategy, having a holistic approach, fitting everything into that.
Thanks, Keith. And I think, what's really interesting is that, Prudential was far ahead of its time. I think, as we look at, sort of the different aspects of health and healthcare, really having a data-driven, evidence-based strategy. I mean, that was something that, kind of existed at Prudential. I spend a lot of time now in the predictive analytics space, and I think that, Prudential was doing that before it became cool, before, it became sort of what I've settled on as a career direction. But then on top of it, I think this notion that, healthcare is really, multidimensional. Now in today's day and age, we talk often about social determinants of health. And I think that, Prudential was really doing social determinants of health and understanding the levers that sort of drive people's health outside of their actual physical health, in ways that, I think most companies, most payers, most national health agendas really weren't focused on. So, really, really impressive, and, obviously led by, talented individuals like Keith. And so, moving to Diane, as we think about, workplace adjustments, for a patient that has, a chronic condition like arthritis, what type of workplace adjustments would you want to make, for a person with arthritis in order to allow them to perform optimally in the roles that they have?
Yes, thanks for that question, and thanks also for the great introduction this morning. I think it's important before we start talking about what, to focus on how, and I really think there's a lot of benefit in how leaders of people, managers, and workplaces in general approach how they're going to provide support for individuals with arthritis or any type of disability. And first of all, Keith mentioned culture, and that is so important because, as you mentioned, Paulo, there is stigma around coming to work with a chronic condition, such as arthritis. And so individuals in the workplace need to feel as if they can, just be who they are, bring what they're bringing to work, openly. And many times employees don't. They cover and they pretend that they don't have conditions, especially something that's not apparent like disability. You mentioned lots of statistics. 70 to 75% of people with conditions like arthritis, they're not apparent. And so employees have a tendency not to talk about them or to mention them to their coworkers or their managers because they're so afraid that it might impact their ability to progress in their careers or to advance. And so when you think about finally getting someone to feel as if they can openly ask for some kind of a workplace adjustment, because you've created that culture where everyone feels valued and as if they can communicate is the first thing that you really have to think about, is developing relationships with your coworkers so that they feel as if they can open up and ask for what they need, or that they'll be open to your suggestions on what you think that might be of support to them in the workplace. And the other thing to keep in mind is that not everyone is the same. Everyone is unique. And so, you've met one individual with arthritis. You mentioned several different types of arthritis. So you have to remember that that to take each and every person that comes into the workplace on a case-by-case basis so that you think about them as a unique individual with maybe, if you've met one person with arthritis, you've met one person with arthritis, or it's one person who's blind, or one person who's deaf. Not everyone needs the same things. And many times, you might have a list of things for people who come to you with arthritis, and an individual might not need all of them. They might need one, or they might need several, but it really depends on that person. Some of the adjustments that we think about, you had shown the rheumatoid arthritic hands. So voice to text software is great. The ability to actually speak, and have your computer write for you what you're thinking, what you would like to type down. Other adjustments might be moving, lifting restrictions, or pulling or pushing restrictions, sort of dividing them up between employees so that one employee doesn't have to do as much as another. Grip aids, really important. And also ergonomics. You had mentioned ergonomic program. I guess maybe Keith mentioned ergonomic programs. Extremely important, because I found that many individuals with arthritis need to move. The more that they stay sedentary, the worse sometimes it can be. We've used things like miniature bicycle pedals under desks just to keep people's feet moving. Allowing treadmills might not be a great solution for somebody with severe arthritis, but allowing bicycles into the workplace, sedentary bicycles that people can get on, and they can put their laptop and their computer up there and work away. So having those kinds of aids is very helpful. Not going to be in the average workplace, but something to think about when you're putting in some of these more and more companies now are putting in ergonomic solutions that are for everyone. Sit-stand workstations, adjustable desks, ergonomic chairs. Everyone has an ergonomic chair, regardless of whether, they have asked for one or not. Periodic breaks, having break rooms, having places where individuals can go and you had mentioned fatigue. They might just need a break, some time to rest. And then, of course, flexibility and modified work schedules. And, the pandemic was extremely helpful for individuals with all disabilities because of sometimes the toll that it takes to actually get in and out of the workplace. An individual might not need anything while they're at work doing their role, but they might need help getting there or moving around in the building. So it's important to keep thinking, now and more companies are having everybody come back into the workplace 5 days a week. Those modified work schedules where you have an opportunity to work from home maybe 3 days a week, and you only get into the office 2 days a week for those important meetings and that face-to-face that we see such value in. It was really helpful. It's helpful for the disease. It's helpful for the condition, I should say. It's helpful for the fatigue, and it's helpful for mental health as well. Many people just work better when they don't have to drag themselves or push themselves to get through mass transit or drive or however else they get to work. Important as well to think about spaces in the workplace, not only egress and access, as far as getting in and out of the building, but conference rooms. If somebody has a mobility aid, do you have chairs everywhere so that it's hard for them to get through the room? Or if they're in a wheelchair, perhaps, or a scooter, then it's even more difficult to move around. And so have rooms where, the chairs are off to the side or they're all pushed into the table so that people can move around. And education and awareness, we might get into this a little later, but education and awareness for employees in general is so important, to think about the fact of everyone around you who may have a non-apparent disability, who is not coming forward and talking about it. How can we all act and be and make everyone comfortable so that they don't have to ask for something, so that it's kind of built into our awareness, the way we're thinking about things, the way we've structured our environments. I think that's when we build it in, and makes it, they call it about universal inclusion. That way, individuals can be comfortable, they can think better, they can be more creative and do their best work.
Thanks, Diane. And I think you touched on an important point, and that's that it's not one size fits all when it comes to chronic diseases. Everybody sort of has their own presentation of diseases, and I think things are as we think about even things within cultural norms, there's different stigmas that exist within different communities. Whether or not you sort of display your weakness within your community cultural norms is important. But then there's also other diseases that touch into arthritis, that complicate things, and we'll address some of the mental health concerns a little later. But just really tailoring needs to individuals is super important. And so Keith, sort of going with that theme, sort of a two-pronged question before we get into the mental aspects of sort of wellness and inclusion. How do you tailor wellness programs to really meet these diverse disease needs, diverse population needs, diverse cultural needs? How do you really use that as the foundation for creating a culture of health and promoting a culture of health that's supportive and inclusive for everybody?
Yeah, no, great question. First let me just touch on culture of health. I think people ask, what is a culture of health? I think you're going to get a different answer from everybody what that actually is. I always like to define it as it when you see it to a certain extent. It's obviously well-being is valued in your organization, but they could, leaders can say that, as much as they want, but you don't, it's almost like you got to see it to believe it and feel it. And when you're in an organization that, it really truly has a culture of health, you'll be able to ask their employees, do you have a culture? They'll say, yes, we do. And that probably includes, work environments that are conducive to health. And Diane touched on work environments, for people with disabilities, but it's also having a work environment that's important for health, having healthy food options in cafeterias, having areas where people can exercise, stair climbing, whatever it might be, in the walking paths outside, just having that environment where it's health, health is encouraged. And also back to the culture of health, having leadership commitment from the top down, I think is very important. But that's not all you need. You really need a top-down and a bottom-up approach. Of course, you need leadership commitment from a top-down level to provide resources and show that they are committed to it. But I think having a bottom-up approach too, and that's where engaging wellness champions in your organization to really help promote programs, and even putting in formal wellness champion programs are really a great resource to use to help encourage and promote health and wellness, at all different levels within the organization. So then get back to your question about diverse needs. I think understanding your population is important. So again, I love data and using data, so really looking at your data and your demographics of your organization and looking at, what do we mean by a diverse population? First of all, I think there's a lot of different ways to do that. You can look at, racial makeup, ethnicity, gender, gender identity, all those are different diverse populations that you want to look at. But it's also looking at different work populations. Throughout my career, I've noticed, for example, in call center environments, maybe people are a little lower income, their jobs are different. They have much different health needs than somebody who might be in a finance position that makes a higher income. So looking at your demographics across all aspects, and then looking at your healthcare claims data and looking at your prevalence of different conditions. What is your prevalence of arthritis? What is your prevalence of arthritis at certain locations or in certain divisions? And looking at it, focusing on it that way. I think so there's a lot of diversity within an organization that you may not think of as diversity and diverse populations. And I think offering, variety of programs, something for everybody. As Diane mentioned, it's not a one size fits all, especially if you're doing, wellness challenges or offering incentives, to make sure that, the challenges that you offer, that there's something for everyone to be able to do it, that people can do it at all different levels, regardless of their disability. If you're using outcomes-based incentives, which I don't know if a lot of companies are using that much anymore, being sensitive to cultural needs. For example, if have an African American population that tends to have higher blood pressure, don't make blood pressure reduction a part of your incentive program because it may not be fair to that population. So understanding those things when you're developing those programs. I think in your communications as well. I think communications is a huge part of culture and getting those messages out there and also promoting what's available, but communicating in ways that may reach different people differently. Some people don't like to just get emails. Some people like more in-person communications. Making sure your communications are diverse and are addressing every different populations. So I think that's an important consideration as well.
I think these are excellent points, and I could tell you culture of health for organizations. I think you're spot on, right? It's one thing to talk the talk. It's another thing to walk the walk. And as I've been part of organizations, there are things that I've been involved with on human resources side that may not be seen as a health related topic. Things around diversity, equity, inclusion, for example, have been really very important when I've seen blind spots in the organization to be able to identify them as as missed opportunities. Is really part of how we should all function when it comes to leaders of people and sort of managers of people's needs, but then also sort of health employees, health executives, et cetera. So Diana, you have three-pronged question to kind of address, some of the best practices, of health in patients with chronic illness. And so, maybe this is a good spot to kind of address some of the mental health tools, but, what are the best practices, benefits programs that really meet the needs of employees with, arthritis and all of the sort of, comorbid conditions that they have? What's absolutely required by companies as you're thinking about best practices, and if based on requirements and based on sort of needs and not only the have to haves but the nice to haves, what are the policies that companies should really have in place for employees with disabilities to make sure that they're compliant and make sure that they're appropriately communicated as well?
Yeah, there's a lot packed into that question. I think I'll start with the mental health, because any time that someone has not just arthritis, but any type of disability, and as I mentioned, 25% of the population in the U.S., 3 billion people worldwide, but 25% of the U.S. population are people with disabilities. And as I mentioned, 75% of them are not apparent. So they're people, your coworkers, you turn around, we could take a poll. How many people know people with disabilities? And and everyone in the room raises their hand, and or they're a caregiver for somebody with a disability. The point being that over time, that takes a huge mental health toll on individuals. It's wearing. And it also can lead to, if you can't move, you mentioned obesity, if you can't move, if you can't exercise, you see everybody else around you exercising and keeping their weight in check, and you aren't able to do that because of the pain or the whatever the condition is that you have, then you're going to be, you might be anxious, you might have depression, it might be various levels, but you're going to, at some point in time, need to talk to somebody. You're going to need to have some behavioral health or mental health support. And so it's so important that we're aware of that as we either coworkers or we lead people, that we send them to the appropriate employee assistance programs that we have. I mean, hopefully most companies have EAP or some kind of behavioral health program, and that is essential to have a good culture, as we've been talking about in the workplace. And so just ensuring that employees get to those resources, that they know about those resources. We talked about communication one-on-one, where either a coworker or a manager needs to open those lines of communication and listen. Let the person not tell you what they need, but more what they want. What's going to help them. And so that communication goes broader when you talk about your entire workforce and communicating those benefits, regardless of what benefits that you have, making sure that they're out there everywhere. When someone's hired, when somebody's going through performance reviews, when they're just generally posted on intranets and internet sites, signs, postage, everywhere individuals in the workplace look, they should be able to see where they can get those resources. And EAP and mental health resources is so important to that, so that they know that people care and that people there's someone there that can help them through whatever they're feeling. Because any health condition, any disability creates other feelings that impact your ability to be positive, to come and want to work hard every day. You talked about presenteeism, and that's what we see. If you don't have the ability to release and get help for the mental health concerns that you might have, it's going to impact your ability to work and to be productive in your role. As far as other benefits go, and I'm sure Keith can speak to this as well, I mean, you want to have options for employees that they know that they have different, some employees don't need a low deductible because they don't have those kind of conditions that would require frequent visits to medical providers. Other folks do. And so you want to ensure that you have all kinds of medical options and that you often bring in, I mentioned training and awareness programs before, that you often bring in experts from various organizations that can speak to disease processes or conditions that individuals might have in the workplace. And so that people, when you start talking about it and communicating more about it, it makes folks feel more comfortable. And they feel like they can then ask for whatever they want to be successful. The other thing you briefly touched on was what's required. And, when it comes to individuals with disability in the workplace, the only thing that's required for employees is to provide a workplace adjustment. Here in the US, we call them accommodations. We refer to them as adjustments in other parts of the world. And if an employee asks for something, you're required to provide it. You're not required to provide exactly what they ask for. Let's say somebody asks for Bose headphones. Well, Bose headphones are, the ultimate, right? We all want, the best, the most expensive Bose headphones. But there could be another headphone out there to help individuals who need to work on distractions in the workplace and they need headphones, or they might have, some hearing loss and need headphones. And so there's other headphones that you can provide as an employer that do the trick, that give them the same results as the most expensive headphone. And that's what you need and what you're required to provide. But it's also important that companies understand that employees are required to ask. So employees can't assume that even if they have an apparent disability, when they appear in the workplace with a disability, perhaps they appear with some kind of a mobility device, that employers are going to know exactly what they need. There has to be that interactive process, that more communication and discussion about what it would take for someone to do better in their role, or to be more comfortable as they perform the activities of their job. So it's not all on the employer is the point, that sometimes it really does take that interaction on the behalf of the employees, where a lot of times we see that employees open that door and they start asking for some kind of an adjustment, and then they stop communicating. And so the employer can't do anything unless, you continue to have that back and forth. But as far as benefits, nothing's required for individuals with disabilities. It's more what's going to help people work at their best. And again, we can talk about culture all day, but it's having that environment where individuals feel like they're valued, they belong, and that regardless of whatever difference they bring to the workplace, that they can thrive and be accepted and be comfortable asking for some kind of an adjustment to make their life and their work easier.
Thanks, Diane. And so there's a question from the audience, but I want to just on the mental health theme, get some thoughts from Keith, and then I'll ask you the question, Keith, just to continue with the theme. So how do you address mental health and stress management, as you formulate a wellness strategy for a company?
I think that the first thing you obviously need in place, and most organizations do have in place, is the proper counseling and therapy that's available through health plans. But one of the challenges that is always arises is access to care. There are providers that are in network, and so that's something that I think it's important to look at. And there's a lot of organizations popping up like Spring Health that allows easier access and getting uh, providers into plans. So that's something that's obviously important. EAP services, having those available. On-site EAP services are really great tools to have if your organization can have those. I know there's often a stigma around people going to see an EAP provider in the workplace, but in my experience, I found that if done properly, you can really mitigate that issue. Although it is an issue to think about when you're designing that. But having them at the proper locations too, with again, that goes back to identifying your workforce and seeing, especially if you're an organization that has multiple locations. We experienced this at Prudential, for example. I remember one of our locations, through our data and our utilization of different mental health care, we saw high usage at one location, so we put an EAP person on that location to try to help that, and that was very effective. So it's really kind of, again, looking at where those needs are. I think going back to the culture issue, I think there's a lot of things you could do, creating a culture that's going to help with stress management. Having quiet rooms, or what we had called in a previous organization, serenity rooms, that are places where people can go to relax and take a break from the day. But not only having those, but encouraging use of those locations, encouraging people to take breaks during their day, take walks. Again, that all comes part of the culture, and making it okay to do that. Taking work-life effectiveness, seriously, and really, understanding that people have lives outside of their work, and encourage them use of taking their PTO time. A lot of people do not take their time. Some organizations have made it mandatory to take PTO time. So really encouraging that use of time, so people have that time to re-energize and come back stronger, and really preventing burnout in the organizations, which is definitely a big issue. I think having peer support around mental health. There's a lot of organizations now that are putting in mental health champion programs, and having those resources are really great, because these are just employees who are trained in providing support for their fellow employees and their colleagues, and being knowledgeable of resources that are available, understanding when situations may be emergency situations, but being trained in that, and maybe allowing an easier resource for employees to go to, where they may not want to go to their manager or supervisor because they don't feel supported. They have a colleague that they can go to get guidance on the right support. So I'm a really big fan of mental health champion peer programs. I think around mental health, we talk about leaders. I think it's very important to provide training to leaders on mental health. Make sure they're first and foremost aware of all the resources that are available, but how to deal with understanding, the stigma that's around it, and what they can and can't say. I think a lot of leaders, in my experience, are sometimes afraid. Don't come to me with mental health issues, because they're afraid they're going to say the wrong thing and they're going to violate HIPAA laws. But providing them the proper training on that could be very vital, for mental health in the workplace. And I think another thing that's overlooked too is, recognition and appreciation of your staff and your employees, providing that, so they feel, employees feel like they have a sense of purpose in the workplace. That's, I think, a huge burden of stress if they constantly feel like they're not doing the right thing and they're not doing their job properly. So really providing that positive reinforcement that's that's needed. I mean, there's a lot of things that leaders can do to support their employees. I think that's very important. I mean, one thing that always comes to mind that goes such a long way with employees' well-being in the workplace is just saying hello to them in the morning. Something as simple as just acknowledging them, hey, how was your weekend? You know, things like that goes such a long
Mhm.
way. But I also think that leaders can provide support for mental health and, you know, and practicing what they preach or being role models and examples. You know, with their you know, if they're taking their breaks during the day, they're utilizing the services. Maybe you see them down in the fitness centers if you have them. You know, that goes such a long way. Then now it's, you know, employees feel like, oh, it's okay for me to do that as well. You know, so if you have these resources and nobody, you know, leaders aren't using them, employees just naturally kind of take a step back and say, they're not using them. I'm not going to maybe, you know, taking time away from my work. You know, so really setting a, you know, strong example is really important.
If I could just add to that, Paulo,
Yep.
um, Keith had such great ideas there for building that safe space in the workplace. But one of the things that we found is building things in and making it easier for people to get. But when you talk about EAP services in the workplace, sometimes it's so important, as he said, to have it on site, make it available so that you don't have to make that phone call, that it's just there. But people might feel concerned about showing up at the EAP office. And so what we've seen is you call it something else. You call it, health coaches, or, it just so that it's not so daunting when, I recommend to an employee, maybe you need to talk with the health coach. Sounds a lot better than sending them over to EAP, you know. The other thing I'm thinking about is that would alleviate stress and some of the mental health issues in the workplace is making some of the things that I had mentioned earlier available to everyone. Not just the ergonomic equipment that sometimes now is built in, but the assistive technology, so that there's you have a place where you can go and order pens and paper, which kind of I guess is antiquated at this point, but computers and technical equipment that you need to do your job. And also at the same place, have a catalog of voice to text software or captioning services or other kinds of ergonomic and assistive technology that will help individuals with whatever condition they might have, especially an arthritic condition where they might have trouble with their extremities. Even a place to order a scooter, when you get to the building, that there's a catalog that you have a scooter waiting for you every morning, or evening, or whenever you're working to get to your place, that your work spot, your workspace. So yeah, building those things in and making it so it's less, you don't have to ask, you can just order it, is so important, and makes people feel more, it alleviates some of that stress, especially the stress of having a health condition and trying to get into work every day.
And I think you both touched on, so Tony has a question, what steps can you as an organization take, perhaps at the leadership level, to encourage a culture where advocacy is shared and not on the shoulders of the disabled community? So I know that, sort of making things equitable in terms of ordering so that it's someone doesn't have to declare themselves as having a disability. It could be part of their normal routine is sort of one of ways. Any final thoughts on Tony's question?
Yeah, I
Around.
think one thing that is important to keep in mind when you're talking about leaders. Who are the leaders? So when I talk about leaders and training leaders to be able to better do some of these things, is all levels of leadership. You may have great senior leadership and support, but an employee's job is really only as good as their direct leader and the person that they report to. So sometimes you have senior leadership commitment, but as it comes, down the line to some of the line managers and the lower level managers, they're, trying to work and manage, their team. And sometimes they don't, do what's necessary. And they're the ones that the employees directly impact, work with and are impacted by. So it's really important to make sure you look at all levels of leadership when you're doing this, anybody who manages people.
Diane, any thoughts on spreading the responsibility and not leaving it all on the shoulders of people with disability?
Well, I think that a couple times we've mentioned training and awareness, and I think that that touches on what Keith just said about having leaders of people be more aware of what individuals in the workplace might be experiencing from all different types. So I think so many times when we think about development and training of people or workshops in the workplace, we think more around business lines. And sometimes it's important to remember that we're working with people and that we have to pay more attention to the people aspects of, who's coming in and working with you day in and day out. And we've mentioned communicating, we've mentioned listening, but I think that that goes a long way. It goes in, and as Keith mentioned, just saying hello to somebody and asking them how their weekend was can make a big difference in how someone feels provided for, cared about, and wants to work hard and be loyal to that organization and that manager.
Awesome. So one quick sort of speed question, and then I just want to kind of end on, a discussion of the future. So, Keith first, how do you measure success? And the same question, I'll go to Diane afterwards. So.
All right, that's a tough one for a speed question, but I'll. There's so many different ways to measure, success, and it's not always easy to do it with data and measuring your success. I mean, there's obviously things like participation numbers. That's how we used to only measure success, how many people participated. But it's obviously much more than that. It's with different levels of engagement in the program. It's looking at outcomes, medical outcomes, but that's sometimes tough to tough to do. So let me kind of talk more about that. I think like when you look at ROI, for example, return on investment, which everybody knows that term, and some people organizations are asked more than others to do that. I think sometimes that could be a trap to look at that. Did this program reduce healthcare costs? I mean, it's so hard, especially when you look at a holistic view of health. Was it this program that did it, or was it that program that did it? Was it a combination of one? So it's really hard to pinpoint, particular programs that are having impacts on results. So I like to look at kind of larger measures of success. And they could be, medical conditions improving, looking at health risk assessments. It's a health risk of your population improving. That's certainly a good measure of success. But looking at performance and productivity, I feel it's very important to focus your measurements and your measures on those sorts of things, because those are the things that have an impact on the bottom line for the company, but also, in the process of improving the health of your employees. So looking at, absenteeism data, presenteeism data, which you mentioned earlier, is very difficult to measure, but nevertheless is a real thing. So if you have ability to look at that, it's something to look at. But looking at other productivity measures like disability rates, are we improving our disability rates? I've done a lot of kind of correlation of different data, looking at those with different health conditions. What are their rates of disability versus those that don't? And you can clearly see, differences there, but you also see huge differences in manager support. We used to measure manager support as a question on our health risk assessment. Basically, do you feel supported by your manager? And we kind of break it down to different areas. But the bottom line was those that felt supported reported much less stress, much higher productivity based on productivity questionnaires. They reported much less days lost on disability. So all those things, looking at financial stress and people who have financial issues, same thing. There are people that are, financially stressed or are not as satisfied with their job, have less productivity, or out of disability longer. So all those things tied together. So I think kind of cross-referencing and, making those connections, and then using the data, which is really important, to tell the story. What is the data telling you? It's telling us that employees that are supported are less stressed and more more satisfied with their job. Use that data to get support from leadership and show them this is why it's important. Leaders, while they care, they don't really care about, improving somebody's health condition. So, yeah, I know they do it on a human level, but that's not what drives them and really doing it and making it part of the business case. So I think it's always important to make the business case for health. Yeah.
Diane, so
Yeah, it's interesting. Keith mentioned lots of data points. I actually think that the beginning of success is an increase in requests. People feeling comfortable that they can come forward and ask for a workplace adjustment. So the more requests you get, the more successful you're being because people aren't suffering in silence. They're coming forward, they're saying what they need, and they're getting results from it. It's important to them. BRGs and ERGs are really important in the workplace. It's one of the things that we didn't mention that companies can do. But it's so important for individuals to feel as if they have others that they can talk with that share some of the same experiences, the lived experiences they have as a person with a disability. And so if you have a BRG or an ERG that's focused on disability or caregivers, that can be that can lead to lots of successes in the workplace. Those individuals get a lot of business skills from working in those organizations that help them in their careers as they move. Seeing disabilities at higher levels, employing more people with disabilities, to me, that's success. And then reporting that on your ESG reports. There's a lot of focus right now on environmental and other statistics, sustainability reporting in the business. And to have numbers of individuals with disabilities included and seeing individuals with disability at the leadership ranks in workplaces, that's success. That you've provided a workplace where people with arthritis or any other kind of health condition can come and feel comfortable and rise up through the ranks and be the leaders of the workforce. So to me, that's what success is. But it's important for companies to know that they need to communicate that and put that in their reporting processes. So many times they're afraid to put those numbers out there. Have a self-ID campaign and then advertise how you did. That's success for me.
Just
excellent.
One last point that I think one of the most
Yep.
powerful ways to show success is anecdotal stories, success stories.
Yes.
Sharing those success stories. Those are often more powerful than any other communication you can do. And if somebody's having a success story, other people are having a similar success stories. So gathering those stories and sharing those.
Yeah. That excellent point, Keith. We didn't mention storytelling.
Yeah.
Storytelling is Tony had asked about what companies can do. So encourage storytelling. As Keith said, that can go a long way.
I think it humanizes the numerics that we often are so data driven as executives to kind of try to understand. And I guess the final question, and again, probably another speed question, but probably not a speed question. Is in my discipline and sort of in my practice of healthcare, there's been ebbs and flows related to the political milieu that happens in the United States, and there's a short-term future and a long-term future of how health and wellness looks and how disability inclusion looks. And so if I could just have sort of, short-term, long-term, future based on what's happening now politically, where we can kind of see things in the world heading, just wanted to get your thoughts on that, Diane.
Yeah, that is a big question right now. And all my clients that I work with are asking the same thing, what do we do in this environment? And I recently, I'm going to go to a group of chief diversity officers. I was recently in a meeting with a large group of chief diversity officers. And some of them, were thinking about making changes in their titles and making changes to the way they structured their workplaces. But most were just focusing on the main things. Many of the things that we've talked about here today is helping people to feel welcome, to feel supported, to have the products and services that they need to be successful and build that culture. And so regardless of what you call it, it's health and wellness or global health or, or diversity, inclusion, whatever it is, you don't have to put a title on it. You can just create the milieu, the environment where you have benefits available, you have the services available, and that people know that it's okay to talk about who they are and ask for what they need and share and tell those stories internally with their coworkers. So it's they're focusing right now on the culture. And so that culture, I mean, companies have cultures for decades, and so if you build it, it will stay and you will draw more people in. You'll be able to, have, better results financially. There's all kinds of statistics around where you have a place where people feel comfortable and no matter who they are coming to work, that those companies thrive. They have higher profitability, better financial results in general. So that to me is what companies should be doing right now for the short and the long term, because whatever they do now will build for the length of, many, many years to come.
And Keith, same thing,
Yeah.
crystal ball, what does the future look like?
Yeah, I mean, that's a great question. I think distinguish between short-term and long-term is difficult because I think they all kind of play into both of those. I think, mental health, addressing mental health issues is clearly, especially post-COVID, has been a rising concern and one of the number one focuses of many organizations. And I don't see that, really changing anytime soon. So I think addressing mental health is a big thing. Technology is probably one of the biggest things that I see, changing in the workplace in the near future and even in the long term, with AI becoming much, bigger and, exploding like it is now. So I think there's many potential impacts of AI in the health and wellness space, around treatment and even, programming and customizing program. Years ago, IBM started with AI looking at cancer research and, lining up people with proper care and clinical trials. And, I don't think it really quite worked yet. Maybe it wasn't developed as much as it is now, but I think with AI going the way it is, I think there's a lot of unknowns of how that's going to impact, really the workplace and, and definitely technology, solutions. More and more people are wearing wearable devices where it used to be the Fitbits that would measure your steps. Now you wear the Apple Watch and it measures your heart rate and your EKGs and your sleep and can tell you. My friend the other day, "Oh, I think I'm getting sick." It's like, how do you know? Well, my watch is telling me. So I think there's a lot of areas where that's going to just keep growing and becoming bigger. And one other thing that I think about too is, the impact of the GLP-1s. I don't want to underestimate that. I mean, also from a cost perspective, I think that could become a big, issue for corporations and, and health benefits, but also the impact of long-term impacts of those drugs. Are they really reducing obesity? We know obesity is related to all kinds of conditions, arthritis and cancers and many different things. So is there going to be some long-term impact, in 10 years from, larger percentages of people utilizing these? Don't know, but it's something to definitely keep an eye on. I know a lot of organizations, are keeping an eye on, if anything, from the cost perspective. And then, you mentioned DEI. I think there's a lot of question marks there about how that, may impact things. And, I think in the short term, and I've seen this too, is a lot of family-related programs as well, fertility programs, for women and programs for menopause. You're starting to see growing a lot more and more because these are things that really impact, employees and, in their lives and in the workplace.
I think it's a great way to end and sort of looking back retrospectively on the GLP and longevity. I mean, I remember being at Pru and having conversations with senior leaders who were using insulin resistance treatment for not having diabetes as a way to kind of increase longevity. And this was long before GLPs were kind of the discussion. And so, yes, inflammation really comes from things like insulin resistance. And in terms of looking forward, and I think, on the front of technology, When the stethoscope first came out, there was a lot of challenges and a lot of barriers to adoption. You were putting this piece of metal on someone's chest and, listening, and it was, sort of invasion of private space, and, there were sounds that you couldn't understand and interpret. I think AI, machine learning, really has the opportunity to kind of step up and mitigate some of the gaps that exist in terms of the necessary resources to provide the best level of care for people with all kinds of diseases in a personalized fashion. And so I think that, the black bags of clinicians on a go forward basis are probably going to include solutions that are tech enabled solutions that are going to be part of it. So, and I'm all for wearables. I'm probably one of the most connected people you'll ever meet beyond my Apple Watch. I have rings and so a whole bunch of stuff like that. So couldn't agree more that health really is happening at the point that someone's at. Meet people where they're at, and that's how you deliver health, right? And I think that's the message of what we've kind of discussed here. And so, look, it was great to connect with Diane and Keith again. I miss working with you, and again, I've learned so much from you throughout my career, and certainly here. Powerhouse team that sort of got together, and it was even more poetic to see how our individual music kind of came together into a symphony, and it was great to have the last 45 minutes or so to play a couple tunes and to jam out. So thank you very much for your time. And without further ado, I'm going to send this over back to Emily, and she'll close up the show here.
Thank you, Paulo.
Yeah, thank you, Paulo, Keith, and Diane, for the incredible, informative discussion we just had and for sharing your expertise and knowledge with us. Now I'd like to introduce you to Stephanie Hudgens, Director of Field Engagement with the Arthritis Foundation.
Hi, everyone, and thank you so much for having me today. I'm just going to go over really quickly a solution that the Arthritis Foundation has created to help support employees with arthritis. Give me just a second. Hopefully everyone can see my screen. And I've already introduced myself, so I'll move on. And before diving into arthritis at work, I'll actually share my own story. I was diagnosed with juvenile rheumatoid arthritis when I was 2 years old, following a persistent ankle inflammation when I first started walking. So like Sarah pictured here, I've lived with arthritis my entire life. In my first job as a babysitter, I remember struggling to keep up with little feet. I had my first joint replacement surgery at 24. Even today, after a long day at my desk, I often find it challenging to get my joints moving again. And I share my story to put a face to this widespread disease and highlight the everyday realities that so many of us face. And Paulo and Keith have already shared incredible insights about arthritis this morning, but I just want to reinforce that it is more than just a little pain. As they've said, 1 in 4 employees is living with some form of arthritis. And the impact that it has on your mental health is just as significant as the impact on the physical health. Many people feel isolated. 58% say no one truly understands how their pain affects them. In just the past week, 2 in 3 people with arthritis have experienced anxiety or fear. And bringing it back to the actual personal aspect again, I was recently speaking with an Arthritis Foundation volunteer who was packing for a tropical vacation with her husband, and he noticed her packing a heating pad, a sweatshirt, and other pain management tools, and he remarked, "We're going to the beach. You're not going to need those." She responded, "My arthritis is coming on vacation too. If I have a flare, I need to be prepared." And that constant undercurrent of anxiety and fear never really goes away when you're living with arthritis. And this cycle of fatigue and isolation and anxiety often leads to depression. 71% of people with arthritis report frequently feeling depressed. It's clear that managing arthritis goes far beyond just addressing the physical aspects. But the physical and mental toll of arthritis underscores the critical need for greater awareness, empathy, and support, both in the workplace and beyond. You've heard it here today that workplace solutions are incredibly important to supporting employees with arthritis. And when we speak to individuals Through the Arthritis Foundation about what would improve their workday despite their arthritis, they consistently emphasize the need for tools and resources to help manage stress and pain. And many also find immense value in having that supportive workplace, one that understands their challenges and is willing to offer meaningful support. And fostering such an environment can make a significant difference in their well-being and productivity. We also spoke with employers about arthritis, and many had little awareness of the impact that it has on their staff. For those who are aware of an employee with arthritis, they often describe the individual as someone who soldiers on. However, there were no workplace wellness resources specifically tailored to arthritis, which left a gap in providing that supportive environment that employees with arthritis need to thrive. As a result, the Arthritis Foundation created Arthritis at Work, which is a free program to provide employers with turnkey tools and resources in a partnership style approach that supports 1 in 4 employees living and working with arthritis. It's a valuable addition to any existing corporate wellness program, another tool in the toolbox. It's designed to reduce missed work days, boost productivity, and lower healthcare costs, while fostering supportive and understanding workplace. Arthritis at work is vital because it focuses on helping employees feel better physically, making it more likely they'll show up to work. But it doesn't just stop there. By supporting their mental and emotional well-being, employees don't just show up, they become more engaged and productive. Healthier, happier employees lead to better overall outcomes, reducing costs for both the individuals and employers. Preventative care is significantly more cost-effective than reactive treatment, and the Arthritis at Work program provides valuable tips and resources to help employees manage their arthritis proactively and effectively. Arthritis at Work is a web-based digital tool, fully customizable and co-branded for each partner organization. It was designed with the needs of employees living with arthritis at its core. I'm going to switch over to a live demo so we can take a closer look at how it works. So this is an Arthritis at Work demo page. You'll see at the top left here, there is a space for the partner's logo. You also get a customized URL. This really helps it feel like a partnership between the employer and the Arthritis Foundation to provide these supportive resources for people living with arthritis. At the top right, you'll see the Spanish translation button. At the click of a button, everything on this page and all the resources within it are translated into Spanish, which is a really nice feature we were able to add late last year. Moving down, you'll see the 4 areas of employee support tools and resources. So these are regularly updated and refreshed by the Arthritis Foundation. They're tailored specifically for employees with arthritis, and the content does come in various formats, including videos. We lost it. There we go. Including videos, downloadable resources, and more. And moving down some more, there's a For Managers section. This provides valuable resources for the managers and supervisors supporting employees with arthritis. It's about creating a more inclusive and supportive workplace for staff living with arthritis, offering practical advice on fostering a positive environment. At the bottom here, you'll see ways to get involved. We highlight opportunities to engage with the Arthritis Foundation, including timely events like webinars that offer insights for employees managing arthritis, as well as events and other areas where you can raise awareness and connect with others who truly understand the journey of arthritis. At the bottom, you'll see our tags for social media pages and a Contact Us button. The Contact Us button is fully supported. It comes to me, and if I don't know the answer or can't find the solution, I will find someone who can. I always like to point that out because sometimes Contact Us buttons just go into the ether and are never heard from again. We intentionally created the Arthritis at Work platform to be simple and easy to use. As you can imagine, being diagnosed with arthritis can be very overwhelming, and thinking about taking care of yourself from a well-rounded perspective of more than just going to the doctor for a treatment can be pretty overwhelming. So we kept it simple to help support those employees on their journey with arthritis. And for Arthritis at Work partners, we aim to make the implementation and the promotion of Arthritis at Work as as possible. It's designed to ease your workload, not add to it. So our comprehensive communications toolkit provides all the resources you need to get started. But additionally, as the stakeholder for the Arthritis at Work program, those stakeholders will receive a bi-monthly email with new promotional materials and news and updates to keep your efforts on track. And by partnering with the Arthritis Foundation to provide Arthritis at Work for your employees, you would be joining a strong network of over 150 employers. And while some are large nationwide companies, the Arthritis at Work community spans a wide range of industries, company sizes, and locations, showing just how broad and impactful this program is. Partnering with the Arthritis Foundation to provide Arthritis at Work for employees is a smart choice. The process to set up a custom co-branded Arthritis at Work interface is simple. We ask for a completed commitment form, which isn't a contract. It's simply to help us identify the right contact person for Arthritis at Work at your organization. Once we receive that form and the logo you would like to see on your Arthritis at Work platform, we can have your Arthritis at Work up and running within 3 to 5 business days. Implementing is easy, whether you choose to send an email notifying employees about this resource, or if you prefer to collaborate on a more comprehensive launch plan, we're here to support you every step of the way. I'd be happy to answer any questions you might have or cover anything that we have talked about today. If something comes to mind later, please don't hesitate to reach out. I really appreciate everyone's time, and the discussion between Paulo and Diane and Keith was incredibly insightful. I'm happy I was able to be here for that. And I'm excited about the opportunity to work with all of you and support your teams through Arthritis at Work. Gonna check the chat. I don't see any questions, so I will turn it back over to Emily. Thanks again for having me.
Well, thank you everyone for joining us today. Again, thank you to our presenters, Paulo, Diane, Keith, Stephanie. This has been so insightful and such a fantastic discussion. If you have any questions or would like any information from our speakers or about how you can become an Arthritis at Work partner, please do not hesitate to reach out to us. And we do have slides that are available at request. So thank you all for your time and have a wonderful rest of the day.